Hi, everybody. Thank you so much for joining us today for our webinar, Deploying Community Gun Violence Interventions. My name is Jaclyn Schildkraut, and I'm the Interim Executive Director of the Regional Gun Violence Research Consortium at the Rockefeller Institute of Government. Our topic today is particularly important as our nation faces a crisis of rising firearm violence. Yet as we know that different forms of gun violence will necessitate different solutions and that communities across our nation are affected differently by gun violence. Firearm violence often is concentrated in urban cities and specific communities within them, and it disproportionately affects our Black and Brown communities. Community gun violence produces a range of short and long-term impacts for residents, including physical and mental well-being. For these reasons, combating the issue of community gun violence is imperative. Our panelists for today's webinar are individuals who have been doing just that, working on the front lines in communities and with their residents to help reduce firearm violence. We do have a full agenda today, and we'll try to save some time for questions at the end from the audience. You are welcome to submit questions using the Q&A function at the bottom of your screen through Zoom in the taskbar, and we'll hold those again until the end. Now, it's my pleasure to introduce our esteemed guests and invite them to deliver some opening remarks about their experience in working with gun violence prevention and intervention. We will begin with Jerome Brown. Mr. Brown has been employed by the New York State Division of Criminal Justice Services as the statewide director for the SNUG Street Outreach Program since July of 2021. In this role, he oversees all training provided to newly hired and newly promoted SNUG employees and coordinates professional development training that SNUG staff are required to complete annually. He has been a SNUG master trainer since 2018. Mr. Brown joined DCJS after serving as the program manager for Albany 518 SNUG for 4 years, and he moved to Albany in 2017 after working as a violence interrupter, outreach worker, and outreach worker supervisor at the SNUG program in his hometown in Buffalo, New York. It is my pleasure to welcome Mr. Jerome Brown.
Hello, everybody. Like I said, Jerome Brown, originally from Buffalo, but by way of Albany these days. And I just want to thank all my esteemed panelists who are here to provide a little background on the work that we've done. For me, I started off at SNUG in 2015. For those who might not know about SNUG started in New York State in 2009. The program really rolled out in 2010. When we started with SNUG, we had 10 sites across the state, from all the way from Buffalo down to Yonkers. Within the first couple of years, looking at a review of SNUG, a lot of the sites had to shut down just to do the mismanagement of the reasons that the state saw. So after the site shut down, it saw that we needed more oversight within the program of SNUG. So with that, the New York State SNUG director, who was Jeff Clark, his position was implemented. And what he saw is that we actually needed a training director to be able to help provide the sites with different type of technical assistance. So in 2015, a program training director, which is my title right now, was created in 2015 and held by Damon Baycoat, who is now Deputy Commissioner over at OYJ, the Office of House SNUG. Looking at SNUG as a whole, Damon and Jeff wanted to go around the state and look at different areas that was doing this CVI work or this community intervention work. So they traveled from Boston to Chicago to California as well. And for those who don't know, SNUG is based off the evidence-based cure violence model. So they was looking at the things that differ from being in Chicago to being in New York. So they went around the state looking at best practices across the state because they want to implement their own training curriculum for New York State. So with that being said, they borrowed best practice from other sites and across the state. And in 2017, they implemented the first training academy for New York State. I was part of that first training academy back in October 2017. And we had our first cohort of training individuals, which we wanted to have a training individual to assist with assisting at each site. Moving closer to 2019, looking at a partnership with OVS, we were able to provide social workers and case managers to the site. While they were providing us with the social workers and the case manager staff, we were also providing OVS with a connection to the underserved community they weren't able to reach at that time. So after looking at our Jacoby site down in the Bronx, New York, and its uniqueness of having on-site hospital responders and social workers, we felt like this was the best way to introduce a victim to a clinician. So most people from inner city communities are reluctant to work with social workers. So by having a hospital responder in the hospital who was from those communities provided to be very valuable for the victims, and to have a social worker deal with some of the trauma that victims are exposed to during that time. We've been working to help our staff understand what the participants are experiencing. So we always look to put tools in their toolbox. So we've been utilizing training such as understanding human development, Erica's stages of development, identity versus role confusion, trauma system therapy, and most recently, healing center engagement with Dr. Sean Jimwright. We also been looking at ways to help the community build trust with police. So this is something that DC just implemented after the George Floyd murder. So we built a trust building initiative that we've been utilizing, not just our SNUG workers and other police across the state, but we just actually implemented in a couple other cities within New York State. So Utica and Schenectady would be two cities that would be utilizing our trust building curriculum as well. We feel the more we can invest in our staff's personal and professional development, the more we'll be able to empower them to shape and help the others in their lives. Thank you.
Thank you so much for that wonderful overview, Mr. Brown. Our next panelist that I'd love to introduce is Isabel Rojas. Isabel is the Associate Director of Legitimacy and Reconciliation at the National Network for Safe Communities. Prior to joining the National Network, Ms. Rojas worked for the Orange County District Attorney's Office as the project manager for their group violence intervention efforts in the city of Newburgh, New York. In her role, she worked with local law enforcement, city officials, state officials, the U.S. Attorney's Office, and other local partnering agencies to reduce gun violence. Ms. Rojas also served as a police officer with the NYPD and the Port St. Lucie Police Department in the state of Florida. Ms. Rojas, thank you so much for joining us, and I'd like to turn over to you for your opening remarks.
Thank you so much to you guys for having us. I'm really elated to be a part of this panel. Today, I'm going to be speaking on my role as a project manager for the Orange County District Attorney's Office, where I did my work with gun violence. The city of Newburgh is what I'm going to be speaking about. The city of Newburgh, I'm just going to give you guys some content just for questions later and just to kind of give you an idea of the work that I did while in Newburgh. So the city of Newburgh, to paint a picture where the population is an estimate of 28,000 residents within a 3.8 square mile. Is an estimate, the estimated group population that's driving the violence in Newburgh is 171 to about 185, which a total of 13 groups. So I really want you guys to think about those numbers for a minute. A city that is 28,000 folks, and you have about 200 people driving that violence and group members driving the violence. Just to give you some data, gun violence data for the bullet to body shootings that we had when we implemented GVI, which before we get into it, GVI is under the leadership of David Kennedy at John Jay College. It is an internationally recognized action research center at John Jay College. And what they provide is technical assistance to sites like ours when we took over, when we initiated GVI, is bringing in focused deterrence to work with law enforcement and also with local leaders. So when the GVI work was implemented in 2015, our bullet to body shootings were 55. If you look at those numbers, our best year, we started to go down. Our best year was in 2018 that we went down to 8 shootings a year. And I'm going to kind of describe how we were able to combat that gun violence, being that today, we're going to be speaking about, the big issue that we're having in our nation, which is gun violence. And what we knew from our gun violence is that groups are driving the violence, right? That was a small percentage of people that I mentioned earlier. And the term group refers to any social network whose members commit violent crimes together. So just in content for that. The group members typically constitute less than 0.5% of a city's population, but contribute to as much as 70% of homicide and gun violence. And that's what we were seeing in the city of Newburgh. The work in Newburgh. So what did my work entail and how did I contribute to reducing the numbers of gun violence along with our partners, which I really want to concentrate on the partnerships that we had. We had to form a strong partnership, which was between the Orange County District Attorney's Office, the City of Newburgh Police Department, the sheriffs, the state police, probation and parole were at the table, along with some local leaders, the U.S. District Attorney's Office, and of course, everything was under the direction of the national network. So when we started to see the problems that we were having, we did an assessment in Newburgh and we realized who were the people that were driving the violence, right? So instead of blanketing an entire community that people were used to it, we had to blanket more those and focus all of our attention on those that were creating the violence in our city. So we did that by conducting our group assessments, where we came together in a meeting with law enforcement. And when a shooting happened, our main concern is who committed the shooting, who were the people involved, how do we put those people on notice, what kind of attention are we giving them, what levers are we going to pull to be able to combat the violence. So we did this thing called the call-in, and in the call-in, you bring folks that are creating the violence. You bring them in, and at this meeting, you have law enforcement, you have a mother who lost a child to gun violence, you have someone who has been affected by gun violence, someone who's on time. You also get someone who, a local leader that's providing services in the community. And the main message is that we want you safe, alive, and out of prison. And the other message is the first group to go out and commit the violence, we were going to come after that group and pull all the levers that we had to make sure that that violence will stop. So custom notifications was one of the other ways, which more of a customized kind of like a call-in, which wasn't in such a grand place, and I call it grand when you have the college and you have other folks there from the community, community members that were tired of the violence. So these custom notifications were a little bit more flexible, where there was an officer, myself, or the lieutenant in charge. And we would go to your house as a shooting would happen, even bedside custom notifications. If there was a shooting, we would go to the hospital and we will let you know that we wanted you safe, alive, and out of prison. But we were also letting you know that if your group reacted or if your group retaliated, there were going to be some consequences. But with all of that, we saw that with helping folks and telling them, all the consequences, where did the help come in, right? Because a lot of folks, out of the groups are not embedded so much into the violence, and they're just loosely affiliated. So we wanted to make sure that they knew that as much as we were focusing on the enforcement, we were also focusing on helping them. And the pillars of helping came about with providing the small stuff, the big small stuff, right? That a lot of us take for granted, offering protection from risk, addressing the trauma, and of course, providing affirmative outreach. And we found that by doing that, we were able to assess, if we went into a home, we were able to assess that entire family, because we know that once one individual is involved in violence, an individual goes to prison, that whole family does that time with them. That whole family is affected, whether they're targets because they have an ongoing beef with someone, that family now becomes a target. So we wanted to make sure that we were clear with our message. So the focus consequences that we did was, of course, pulling levers where it was either probation or parole. If someone was on parole, we made sure that we contacted parole. We had more frequent visits. If someone was on probation, of course, the frequent visits as well. If you had any type of tickets or any type of outstanding warrants, that you were going to be picked up on it if you were part of that group. So we made sure that the working group and everyone that we had at the table was on the same page to make sure that we can keep those numbers down. And as you saw in 2018, it took a lot of rolling up your sleeves and getting out of your office in a collective collaboration of everybody's part to be able to curb the violence in our city. So as you can see here, the focus consequences were also reviewing cases. The district attorney will review the cases to see if any of those cases will go federal. We have our federal partners involved, any RICO or conspiracy laws that we were able to work on. And then at the same time, as I said earlier, GVI reduces enforcement. We didn't want to blanket an entire community, because why would you, if you have a crime, why would you come out of that person that just came out of work, is probably outside having that beer, now we're giving them a ticket, now we're creating a bigger problem for them. So we wanted to focus on the people that were mostly at risk. So this evidence-based approach represents a promising approach, and when done right, it saves lives and encourages strong and healthy communities. And that's what I have.
Thank you so much for that wonderful overview. Our next panelist is Deanna Logan, who serves as the director for the New York City Mayor's Office of Criminal Justice. She previously served as the general counsel and deputy director of crime strategies for that office. She joined the MOCJ in 2019 as the deputy director of crime strategies and coordinated the efforts of the city's courts, New York City Department of Corrections, New York City Correctional Health Services, New York City Department of Social Services, the New York City Department of Finance, and the New York Police Department to meet the requirements of the city's Criminal Justice Reform Act. Prior to joining the MOCJ, Ms. Logan worked with the District Attorney, Darcel Clark, to design, establish, and supervise the Rikers Island Prosecution Bureau. And then prior to her work with the Bronx, she served as the Assistant Commissioner to the DOC, where she worked to reform and strengthen internal discipline. Director Logan, it is great to have you here, and I'd like to open it up to you for your comments.
Thank you so much. I'm eternally grateful for being included in this panel with all of these wonderful thought leaders in this field. As you noted in my bio, I come to this field later, 2019, having come from the prosecution side of work in this sphere. I want to make sure that everybody kind of understands what the Mayor's Office of Criminal Justice actually is and what our mission is. We are affectionately referred to as MOCJ by those who are practicing and working in this area. And MOCJ really serves as the advisor to the mayor on all matters relating to maintenance and improvement of a fair and equitable criminal justice system. So when we look at this work and we think about what we do, we recognize, as everybody else on this panel, that public safety is not solely rooted in the achievements of law enforcement, that it is bringing together community and institutional stakeholders to address systemic issues that undermine safety and stability of our neighborhoods, right? So when we do our work, we strive to move our city forward by providing better resources and access to supports that are needed to promote and maintain healthy communities for all New Yorkers. And what we recognize, and what Mayor Adams recognizes, is that in order to meet that mission, you need a hub of a huge amount of professionals. So housed within the Mayor's Office of Criminal Justice is multiple programs, but also multiple professionals that I have the honor of leading. We have architects, city planners, former criminal defense attorneys, former prosecutors, criminal justice experts, advocates, academics, credible messengers, former nonprofit managers. We have members of the Department of Buildings, Department of Probations, because it takes a coordinated effort across the city in order to really start to address the root causes that the systemic causes that need to be addressed in order to put forward our fairer, safer, just city. Programmatically, we look at alternatives to incarceration. We look at pretrial to see what suite of services can be provided to the community. We have crime strategists, intergovernmental affairs, and we build multiple relationships across the spectrum in order to do the work that we do. So we work with the Office of Court Administration. We have relationships with all of the indigent defense providers, with the prosecutors, elected official think tanks. And all of those relationships and professionals within this office work in terms of, when we think about gun violence, the interventions and preventions that can be deployed. And we think about that in three different spheres. We think about it environmentally, we think about it based on the community, and we think about it on an individual basis. Environmentally, we look to see where there are spaces that can be quote unquote activated, right? How do you take a space and make sure that the neighborhood and that the community really want to be there, and that you make it something where people come together, they can talk and get to know their neighbors, so that it becomes a safer, more collegial environment? How do you then make sure that community is engaged? And how do you then deal with making sure you get to the granular level of individuals that need that type of intervention in order to be able to be good members of their communities and to help strengthen those communities? When we looked at all of these components, one of the things that was done was to codify our Office of Neighborhood Safety, right? And our Office of Neighborhood Safety combines the efforts of the Mayor's Action Plan for Neighborhood Safety, the Office to Prevent Gun Violence, and our newest member of this umbrella, which is Atlas. It is strength in community safety, healing, well-being by relying on the experience and expertise of community to drive solutions. So we recognize that the solutions to what's going on in a neighborhood actually come from that neighborhood, right? We ensure that the residents of historically disinvested communities are the ones that are given access to resources to be able to define and implement the strategies that are going to make their neighborhoods and their communities safer. When we think about the Mayor's Action Plan, it is making sure that the public housing residents identify key issues, and the key issues that underline the crimes that they are seeing happen in their neighborhood, and participate in decision-making to address those priorities. That brings together all of the city system actors with residents of the most disadvantaged housing developments in order to start to address those underlying causes. Additionally, when we think about how we are working with community, we are making sure that we are building trust. We are making sure that we're designing spaces and that there are opportunities for employment, for work, for education, for play, just healthy well-being and youth development. In addition to our Mayor's Office of Mayor's Action Plan, we also have our crisis management system, which is part of the partners who are in our Cure Violence program, right? So our crisis management system is specifically using partner organizations who have the trust of community, who have been working in community, to provide crucial services and resources to high-risk youth, young adults within the New York City communities that have the highest incidence of gun violence and are disproportionately impacted by socio and economic disinvestment. In addition, those partners are across 31 sites, 28 precincts. We have hospital response, school conflict mediation, therapeutic services, legal aid services, Rikers Island support, Work Plus, anti-gun violence, and RISE. And lastly, Atlas deals with the individual. And Atlas makes sure that it reduces cycles of violence and justice involvement in New York City through intensely community-based therapeutic and healing services, but making sure that individuals that are in this sphere will be getting family functional therapy, so we build stronger families. With that, I thank you and open it up for any questions later.
Thank you so much for that wonderful overview. Our last panelist is Jeffrey Butts. Dr. Butts is the Director of Research and Evaluation Center at John Jay College of Criminal Justice, where he is a research professor and he's also a member of our consortium here. We're very excited to have him as a member of that. Previously, he was a research fellow with Chapin Hall at the University of Chicago, the director of the program on youth justice at the Urban Institute in Washington, D.C., and a senior research associate at the National Center for Juvenile Justice in Pittsburgh. He's published 2 books and dozens of monographs and reports for governmental agencies and foundations, as well as articles in academic and peer-reviewed journals. He's also worked with policymakers and justice practitioners in 28 states and several countries. Dr. Butts began his justice career as a drug and alcohol counselor with the juvenile court in Eugene, Oregon, and we are very excited to have him on our panel here today. Dr. Butts, I'd like to turn it over to you now.
Hi, I also appreciate being here and being part of this conversation. with that long list of my accomplishments, what's clear is that I'm old. So I've been working in this field, in the justice field, for more than 40 years. And a lot has changed very recently in the last few years. And I think we all know about that. Someone asked me recently in a conversation, what inspires me to keep working in this field? And I said, incremental improvements and changes in the right direction, because when people in this country vote based upon fear, bad things happen. And right now we see a lot of fear-based policy and fear-based public pronouncements. Our democracy is under threat. And what really concerns me is we are at risk of becoming a police state because people are afraid. And all the media stories about gun violence and violence in general, the national media love to focus on New York City, of course, because of a lot of media here. And we all see that. But in order to avoid that fate of becoming a police state, we have to prove that there's a better way to create public safety. We can't just claim it. We can't just assert it. We have to prove it if we're going to compete with the public, which tends to believe in policing first. We have to prove that there's a better way. So I started out as a social worker, as Jaclyn said. I worked in the juvenile court. I was a drug counselor. I also worked as a child welfare worker in the foster care system. Those experiences taught me to be cynical about believing that bureaucracy can solve social and community problems. It's clumsy, it's ineffective, it's full of bias and racism and economic bias. It's our country. So we have to build community resources. We need public bureaucracies. We even need law enforcement, but we also need to keep it in perspective that that's not the #1 solution to community safety. So I always assumed when I got involved in the justice field that the purpose of involving someone in the justice process, or what people today call the criminal legal system, was to help people change their lives and avoid legal involvement. That was the pathway to making communities safe, was to work with one person at a time. The problem is the dominant policy perspective is as soon as the word gun comes up in a conversation, everything changes. The assumption goes away about prevention and restorative justice. As soon as you hear the word gun, everything switches to retribution, incapacitation, and deterrence. Each of those things is a perfectly legitimate public policy goal, but if we only rely on those things, we are headed to a bad place. So there's also a lot of confusion, marketing, celebrity worshiping in the field of justice right now, in the field of violence prevention. And another thing is you have to constantly watch out for the little, I would call them racist dog whistles in this conversation. I mean, we know that if you just look at who's being hurt by gun violence, it tends to be in large cities, but that's because a lot of people live in large cities. I did this quick analysis a couple of years ago where I looked at the rate, the probability of being hurt by a gun, being killed by a gun by county. And there are some states where small rural counties have gun homicide rates higher than the largest city in that state. It's just not true that this is an urban problem. And I think we can all guess why politicians like to use the word urban when they talk about gun violence, because it sends a message. We have to be careful about that. We have to be attentive to the politics of this while we build the evidence that there's a better way. So where does prevention come in? If we're going to do something other than deterrence and incapacitation and retribution, that leads you to prevention. There's a lot of cynicism when you talk to people in the public about what prevention is. Political officials, a lot of my colleagues here that come from law enforcement hear the word prevention, and they claim policing prevents crime. But what they mean by that is policing deters crime. Good law enforcement, good policing in a community, the visibility of policing will communicate to people, don't do it, you're going to get caught. That's deterrence. That's not prevention. Prevention is building a social structure in a community where people aren't tempted or impelled to become involved in criminal behavior and certainly violent behavior. And I always tell people, just do the simple experiment for yourself. You think about neighborhoods you're walking through, you know when you're in a safe neighborhood, you can see it. And is that because there are patrol cars everywhere and lots of evidence of people being arrested? Or is it because the houses are well kept, the streets are clean, there's abundant trees and the gardens are nice and there are people walking their dog? You feel a safe neighborhood because the social structure and the economic activity there encourages safety. So why do we think the only way to create safety out of neighborhoods in trouble is to crack down on them, bring the police in and start arresting people, when we know that doesn't prevent crime, that responds to crime? I got involved in this in New York. I'm not a New Yorker by heritage. I moved here in 2010. And I got involved when the city council reached out to John Jay, I think it was about 2012, to help them with something they were starting called the Gun Violence Task Force. That work led my research center at John Jay to start getting involved in evaluating the cure violence model here, which is called the crisis management system. We do that by tracking the incidence of shootings in a neighborhood, small neighborhood, because prevention has to happen in a small neighborhood where people know each other. You can't just roll out citywide prevention because you need to have the relationships with the neighborhood. And that's the basis of the cure violence model. So we track shootings, but we also tracked attitudes and perceptions among predominantly young and predominantly male residents. So we did a very creative way of doing, you could look this up, but respondent-driven sampling to actually ask people in the neighborhood, what do you think about the police? What do you think about your neighborhood safety? Have you been hurt by guns? Have you been stabbed? What's the solution out of this? And we did those surveys as a way of tapping into neighborhood perceptions and beliefs. But surveys can be really expensive, so you have to be careful how you do that. But I think it's an essential thing to ask people about their community, not just assume that you know about their community and then bring the solution to them that they didn't ask for. So I totally agree with Deanna, what she said. Okay, finally, as I said, we have to build the evidence for community safety. One big challenge I see right now in this field is that there's a lot of celebrity rhetoric, people arguing based upon ideology, even faith. Just, I know how this should happen. My people and I are going to do this work. We don't need someone to prove that it's effective. I understand that motivation and that passion, but if you don't prove you're improving public safety, you will never win the argument against law enforcement. If all you have is your beliefs and your passion and your rhetoric, the police structure and law enforcement and all the politicians that back it will always win that argument with the public. So it's a burden, but we in the research field have to work with you in the community to build the evidence to prove that this is the way to go. And I do believe our country is at great risk right now. We have to do this now to start building the evidence and not just use the words evidence-based as a marketing term, which happens a lot with elected officials, but to really know what evidence-based means, generate the evidence and prove that we have a pathway to public safety that does not rely on force or coercion and punishment. Thank you.
Thank you so much. I'd like to invite all of our panelists to join us back on screen for a discussion. And while they're doing so, I would like to just remind our audience that you guys can, excuse me, drop questions in using the Q&A feature at the bottom of your screen. We will save some time. I've seen a couple come in already. We will save some time towards the end to get those answered by our esteemed guests for you. So you guys all definitely bring something different to the table, yet you share the goal of community violence intervention and helping to reduce gun violence in the communities. And so I'd like to kind of open up some different questions and have you guys discuss those. Jerome, I'll begin with you. We learned in your bio, of course, that you actually have done the work on the ground as a community gun violence interrupter and a member of Outreach. What do you see as barriers to being able to deploy community gun violence interventions? And at the same time, what have been some facilitators in getting your work done?
For me, I would say some of the barriers, and I can only speak for the organization that I have been involved with. It's faith-based participation. While there are some sites and CVIs that have clergy on staff or relationships with them, most sites find it hard to have that consistent participation with faith-based organizations. Collaboration among sites with multiple CVIs in the area, Sometimes that get in the way. Most aren't keen to work with each other due to, their need for funding. Everybody thinks they got to fight for the funding, so they can't work with the other one. We all know we lose when we lose a high-risk individual or participant through gun violence. There's faith-based participation at the funeral. We need that participation before that outcome. From a program standpoint, I would say having more incentives for the youth we work with. If we asking them to give up something, you have to provide something to replace that with. So we're looking at some workforce development opportunities for the youth. And when you ask what have been some of the facilitators, I believe it's just having resources to tap into and great community partners who go the extra mile to volunteer and provide services. Many parent organizations have limited resources. So the more you can collaborate with other agencies to connect your clients with resources, the better percentage of a healthy, productive, violence-free life they have.
I see some nodding going on. Isabel, would you like to add to that?
I'm going to agree. I think that one of the barriers that we saw was, of course, budgeting. And I think that we can all agree on this panel, budgeting has always been an issue, correct? Another thing is staff cuts. If you have a police department or if you have agencies that have a quick turnaround constantly, how are we embedding that work within those organizations, right? And that community buy-in. I think that is important. And I know that Mr. Butts brought something earlier is deterrence is just not focusing on when we're getting people, right? Or when we're locking people up. We also have to focus on the fact of if we want a healthier community, we have to have these open conversations and not only have our politicians come out when there's an incident. We have to be consistent and show our faces. If there is community barbecues or things like that, come out a little bit more often and get to know the community. You have to have a pulse in the community to be able to, have these different implementations work.
Certainly, we know, I think, I would imagine your work has all been sort of hampered by the COVID pandemic that we found ourselves in, especially related to that research question. Deanna, how has your office sort of been able to address some of those barriers and facilitators, while we're trying to interrupt rising gun violence in the middle of a pandemic?
Well, so what I have to say is kudos to all of our partners, because even in the midst of the pandemic, we saw partners going out into community and then readapting their model to make sure that they were still deploying resources to community, right? Connecting, at least on the mayor's action plan side, making sure that they were deploying tablets and training grandmothers and grandfathers on how to use them and to be able to connect to resources. We had many of our crisis management systems that were out in the street in masks themselves, handing out PPE to residents, as well as information and making sure that people were connected and knew what needed to happen. So even though there was obviously pullback of being able to have convenings and to bring people together, we adapted to use technology, make sure that technology was deployed and that partners had access to it and the ability to use it.
Thank you for that. Dr. Butts, you spoke a lot about the need for evidence-based, and I'd like to ask you, based on your research, what are some successful intervention programs that you've been able to see, and why were those successful?
So it's a challenge even to use the word program in this field. And that's each program is made up of many, many different parts and components, and we have yet to standardize sufficiently to be able to say this practice makes a difference. This is an effective practice. Even within the crisis management system in New York, when you go around and visit those sites, they're all slightly different. Every director wants to have their own thing, and they say, this is our neighborhood, we know this neighborhood. And so they innovate and create their own thing. And that's great from a service point of view or a community action point of view, but it prohibits anything that you could call rigorous research. And if we have to have rigorous research in order to sustain this movement, we need to start getting serious about measuring components of programs and not the program writ large. And that's just a challenge. So when you ask me what's a successful program, I don't know, but I do know that pieces of programs are effective. And in the crisis management world, I know that a small catchment area, meaning the workers in that program really know the people in that neighborhood, is more effective than a great big catchment area where it becomes a bureaucracy. I also know that what my old social work training would call active listening, where you get to know the people on the street and you listen to what's going on with them. You don't just preach at them and tell them what they should do and how they should behave. You understand their lives. I know that's effective. But how to turn that into a series of steps and an organized component in a program can be difficult. And the last thing, I totally agree with what was said before about the funding. We put way too much of a burden on nonprofits in the community. We expect every little nonprofit to suddenly become management experts and know how to do legal services and HR and real estate to find their space. We really need to support the nonprofits so that the workers just do the work and don't have to become management assistants. And that, we have a long way to go with that too.
I see some nodding from your co-panelists. Jerome, would you like to add anything to what Dr. Butts has said?
Absolutely, and he hit the nail on the head, because if you got everybody doing something different, it's hard to really be able to pinpoint which one is effective. But one of the things that I do believe is when we talk about what programs are effective, I believe when we have these programs who have partnerships or relationships with the local trauma center in their area, I believe sometimes those are the most effective, because when you think about it, when we talk about hospitals, we consider that ground zero for for our work, and that's the place where most people are at their most vulnerable, and they're thinking about the choices they made. You have their family there who, even if we cannot speak to that individual at that time, or even if that individual denies service, we always can engage with that family and see if use that family wants that individual to be safe. So when you have a program that's connected to one of their local trauma centers, I think that's one of the best pieces that when you're doing this work. And I just wanted to say, and about the funding, and like I said, me and Isabel was together, doing Project Rise, and that's something that we're doing right now with DCJS in New York State to try to help these smaller agencies get some funding where they won't have to go through the rigorous, grant writing procedure like you usually see when people try to get funding. So Project Rise in New York State, that's another great tool that we use and try to empower these smaller not-for-profit agencies.
Ms. Rojas, Ms. Logan, I'd like to offer you guys the opportunity to comment on this question as well, since it seems to be something you're all nodding on.
Yeah, I think the issue of infrastructure and asking our partners to do more than what they really do best, right? Which is exactly what Dr. Butts identified and what Jerome Brown identified as, we want you to have that engagement. We want you to do the active listening, to have the trust of your community. That is the work that we want you to do. And we have, as a city, asked them to do more when we say, and now understand the procurement process. And as part of that procurement process, make sure you know about the insurance that goes along with it. And so we have started using models that take some of that pressure off of our partners by using a prime subprime relationship with bigger organizations that understand and can navigate the systems, that allows for technical assistance as well as support in the contracting, the procurement, navigating the procurement, so that that pressure isn't put on our smaller grassroots. And what we see is that that is a better resource for community, because it allows us to open up more to even smaller organizations that really are hyper local, that are able to do the work that we really, really want them to do.
I also want to say, another barrier that I failed to mention is, and we talked about the smaller communities, the agencies. I think accountability is a huge thing for a smaller agency, especially when we are making promises, right? Because with the groups and the folks that we're working, especially in our communities, we have a very small window to help certain individuals that are typically not receptive to services. And it's just being accountable when you are saying you're going to do the things that you are. And of course, it falls back on funding and staffing issues and things like that. But when we make a promise, we got to go through with that promise. We have to. I think that a lot of agencies, like Jerome said, it's like reinventing the wheel. So if you can't do something because you have the funding, now give it to someone else, share with that other agency that might be able to, pass the torch to them. They might be able to run with that individual and be able to help them and assess that whole, family if it takes that. But I think that is one of the barriers that we have seen in our work is the entire, just those promises and making sure that we're doing the work that we are saying that we're doing.
That's such a wonderful point. And I like to turn to you, Director Logan, because I think you're in an interesting position where you're sort of tied in with the policymakers while also being tied in with these agencies and, organizations that are doing the work on the ground and sort of acting as a conduit, perhaps, between all of those different stakeholders. What do you see the needs in terms of policymakers supporting the work of the people on the ground who are doing it, not just in terms of budget, but how else can they support the great work that all of these different programs and practices are working on?
I think the way that we support them best is more coordination, right? Making sure that everybody understands what the other ones are doing and connecting them, because a lot of what we see is in boroughs where the partners are much more connected, that they have better access to how to do it better, right? They know this is what's been working for us, or this was something that was a challenge, and being able to share that information across their fellow crisis management systems or the fellow domestic violence organizations in the neighborhood, being able to have that coordination and that bridge of communication is something that I think we could do better, but that is the way that we could support best.
Other panelists, I'd like to open it up to you as well with that question.
That was how to help programs?
Sorry, yes. How do you think, and I know that you, Dr. Butts, in your overview were not necessarily critical, but, wanted to make sure that we were getting policymakers the evidence to make those contributions. How else beyond, you raised some important concerns about evidence-based and creating that evidence. How else can policymakers support the people who are making the connections and doing the work?
Let them be at the front of the stage. I don't know how you get elected officials to sit in the back, but if they would learn to do that, it would really help. But at the same time, I think we need to work with the people that are called to the front to speak. I would love to help them learn how to talk about evidence and data and research in a way that is safe for them, that's supportable and effective, because people tend to over attribute effect. Even I saw President Biden at a press conference use these very lovely words about community violence intervention, greatly exaggerating their effect. And you just know that there are a lot of very smart researchers who are, back home taking notes about how they're going to criticize things. We need to anticipate the criticism and be prepared to talk about evidence in a way that's productive and reliable, supportable, because the critics do come.
Isabel, I'd like to ask you a question. I noticed in your statistics that you shared from, your number of shootings that you had a decrease. You reached your lowest milestone in 2018. 2019 seemed to be a rebound year, and you guys course corrected in 2020. What do you think attributed to your being able to kind of, see that rise and then regroup quickly or maybe pivot to make changes needed to support your community?
Honestly, I have to say that was the great work of the collaboration. So once you have established that at the beginning of any initiative that you're doing in any community, I think the people that you have at the table, I always say the people closer to the problems are the ones closer to the solution, right? So being that we had a healthy relationship with our parole, with our probation, with our social service, just with the folks in our community that were providing the services, we were able to react quicker versus if we would have been starting from day one, right, from ground zero, where you're like, what do I do now, right? And then going back to the table. So I have to say that was the work of some really great collaborations throughout the city of Newburgh. The partners that were at the table, those were strong collaborations during those years. And I think that was a testament of the leadership that we had in place to be able to get us where we needed to go as fast as we did in curving those numbers before they went, again, haywire.
Oh, Jackie,
I forgot to, it figures it would be me. I just want to go ahead and loop in some of the questions that we got to the audience and to remind our guests that you guys can drop questions into the Q&A. We'll have a couple minutes for those before we close out our session. Director Logan, we actually got a couple questions for you. If you could just speak a little bit more about the Atlas program or initiative, and also some of the resources that you're really seeing being funneled into those different agencies that you're supporting to help with the community gun violence intervention initiatives. Nope, you're muted now.
It's contagious, Jackie, it's contagious. So unlike the other programs that have acronyms, right? Like MAP, Mayor's Action Plan, OPGB, Office to Prevent Gun Violence, Atlas is actually what it says, right? It is the person who keeps the world on his shoulders. So we are taking on individuals who are the people that are at the most elevated risk for violence and violent reoffense. They have backgrounds that are repeat or escalating court contact. They reside in communities. They have family conflict. They're exposed to violence and or victimization. And our current ages are between 13 and 27, and kind of the engagement is to have somebody that is vested in them. So they're the people who have been released on their own recognizance, who are at this high risk, who we will deploy a partner who is in their community, who understands who that person is. And the expectation is when that person first goes to engage and talk to them, that they're going to be told to jump in a lake. And much like Isabel said, it's the consistency and accountability, right? So that person is going to say, sure, I'm going to go jump in that lake now, but I'll be back on Tuesday at 3 o'clock with a coffee. And the person comes back on Tuesday at 3 o'clock with that coffee and consistently comes back and back to engage. And eventually what we've seen is that people start to avail themselves of that person that is vested in them to get the family functional therapy, to start engaging with addiction services, whatever the things are that they need for their benefit. As far as resources, we have really invested significant dollars in making sure that people have meaningful employment, right? So what we know is that individuals need a way to support themselves, but we also know that people don't necessarily want to engage in anything that's just a one-time, one-shot deal. So last summer, we started our Precision Employment Initiative in partnership with Block Power, and we created cohorts of individuals who were at risk for either being victims of gun violence and or had been perpetrators of gun violence themselves at some point. And they are enrolled in training to have green jobs. They are given wraparound services for the soft skills, and their jobs are at the times that we saw the highest rates of gun violence. But those are jobs that are skilled labor, and they are higher paying jobs. The average job is $23 to $41 for an hour for those individuals. And we've seen quite a few success stories where people have been onboarded into the companies that they started in the program.
Thank you for that. Dr. Butts, we have a question for you. One of our guests said that they really appreciated your comments and want to know, what do you think is the biggest barrier right now to proving the effectiveness of community-based solutions?
Well, my first instinct is to say resources, because that used to always be true, but now there's so much money flowing. It's really investing those resources that's the challenge. And I keep referring to the need to build evidence like an investment portfolio. What policymakers tend to do, elected officials at all levels, is they hear about the latest fad or the most popular thing and just start writing checks and throwing money at that thing. But what we need to do is focus our investment for research on things that are promising and sound good, but have yet to be really supported clearly with research. Like stop spending money on family therapy, mentoring, all the things that we already know a lot about. That's part of the toolkit. But we don't know exactly, your question before, what makes a community-based violence prevention program good? What makes it effective? We don't know yet because the research resources that go into research is really still meager. So I wish there was an emperor of investment controlling all federal funding to go to research and not just spending it on fads. And one more thing, which is sometimes the best ideas for violence prevention cannot be studied with random assignment studies and experimental designs. So stop insisting that that's the only credible evidence. Because if you only accept random assignment studies, you end up with an entire field based upon therapy and enforcement, because you can do individual level analysis. We need community level analysis, which is really hard to do using a randomized design, but has great promise for long-term impact. So that emperor of investment also has to be smart about standards of evidence. That's all.
Thank you. And a follow-up question that came in, I'd like to pose this to all of you. One of our attendees said, I always hear people say investment in resources to prevent crime without much elaboration, although Dr. Butts did give us some of that. What are some specific examples of where we need to be investing and what resources should we be investing in your opinion, especially for those of you who are working on the ground and in the communities?
So when I think about where we are, I always say something that nobody thinks about, right? We started back under the de Blasio administration, pre-K for all. It was an investment. And for me, that was one of the biggest investments in public safety, right? You're bringing in and you're building the pillars that give everybody stability. For the next step for us is housing, because as Dr. Butt says, there's tons of money. We have invested quite a bit of money in social workers and people who can provide the mental health services. But if I cannot find you because you do not have a stable place to lay your head and the Fortran is your bed, then all of that investment is for naught. And therefore, making sure that we have the stable housing that is fits for the people that we are trying to serve. So that may be families that need to have that stable housing so that the young people have stability in their lives. They can avail themselves of all of the wonderful programming that we have. They're not being bopped around. People who have mental health illnesses, they can be found by the people who are coming to give them services. And then people who don't have anybody in their lives and who need that extra support of being able to walk out of their room and get their medication, get their therapy, get all of the things already there for them in that one place, are all things that we need to invest in order to really start to see the needle move on safety in communities.
Thank you for that. I want to be mindful of everybody's time, but Ms. Rojas, Mr. Brown, I'd like to give you an opportunity to comment on your experiences with that question as well, please.
I'm going to say, I'm going to agree with Deanna. I think housing, of course, mental illness is a top priority. We've seen so many things happening. I think more resources for police officers to deal with the mentally ill. I think that's a place that we need to explore more. In providing them the resources as well as the training to deal with folks that are under crisis when it comes to mental health.
Mr. Brown, I'll give you the last word on this.
Right, and thank you. And for me, it's two things. I think we need to start teaching our youth earlier. I mean, if you think about it, from like fourth grade, you know, we need to start teaching our kids about gun violence. And I know a lot of people are kind of apprehensive about that, but you know, if you think about a lot of these same individuals, these same youth, you see them at these shooting responses. You see them at these vigils and these memorials for these individuals who passed away. So that's one thing. And we have to also invest more in literacy, because when you think about it, the kids need the language of conflict resolution. A lot of times they don't know how to get themselves out of this situation. Right now, kids, when they face with these situations or any type of battle, they just got certain words they use. So if we can teach them that language a lot earlier and empower them to be able to talk their way out of these situations, I think the two things that we need.
All wonderful points. Unfortunately, we've actually exceeded our time a little bit here, only by a minute though. I do want to thank each of you on our esteemed panel again for your expert insights, as well as for taking time away from the very important work that you do to share what you do with us and your insights and expertise. If for our viewers, if you have not already, you can read more about community-based gun violence at our website, www.rockinst.org/gun-violence, as well as our other research on different aspects of firearm violence, which we know is a very complex issue. Today's webinar will soon be available for playback on our website, along with new pieces related to community gun violence. If we were not able to get to your questions, we will certainly work with our panelists to get those answered and out through our website as well. And finally, if you are on social media, do not forget to give us a follow on Twitter at Rock Gun Research. Thank you again so much for attending. Thank you to our wonderful panelists for joining us, and we hope that you all have a wonderful day.